An episode of NY Med, televised on July 25, 2014, detailed the successful treatment of a true surgical emergency of a 65-year-old woman who arrived by ambulance to the emergency room of the New York Presbyterian Hospital. Her diagnosis, a condition which, if allowed to progress, is just about 100% fatal. But this fortunate woman's story did not begin with the light-flashing, siren-wailing ambulance ride. It started a few hours before when she saw her personal physician at the Scarsdale Medical Group, complaining of chest and back pain.
I was running to Grand Central on a cold and miserable night and felt that somebody had stabbed me in the chest. Somehow I made it from New York to Harrison, where I live, and was up all night and was having a lot of trouble breathing. But I thought I was having an asthma attack. So in the morning, I decided to call my favorite pulmonologist, Claudia Felberg, and luckily she fit me in first thing in the morning. But I was clearly in some sort of distress.
I had a horrible night the night before with a severe asthma exacerbation, probably the worst one she's had in her life. And she told me the story about the night before, having been in the city carrying some heavy bags and feeling like somebody had stabbed her in the middle of her chest all the way through her back. She found a young gentleman who helped her carry her bags to the train. She was able to make it home, but really was feeling terrible the whole night, not able to lay down because she was so uncomfortable with her breathing. I did a physical exam on her and did not notice any wheezing, which would be a very common thing to find in an asthma exacerbation. So I became a little bit concerned about her symptoms, particularly the pain that she had suffered the night before.
And Claudia did a battery of tests, did some chest x-rays, and called in my primary care doctor, Gary Razies. Gary, who's been my doctor for over 30 years and knows I don't complain, looked at me very sternly with his hands on his chin and said, "Don't BS me, tell me exactly what happened." And I did. And I told him how serious this felt and how scared I was and how much distress I felt I was in.
At the time that we saw her, she had felt that she had had a bad night of asthma, but when Dr. Felberg examined her, took the chest x-ray, and it became fairly apparent at that time that this was not a pulmonary problem. We were very concerned about the nature of the chest pain that she had, particularly the fact that it was a stabbing pain going from front to back. This was very suggestive of something in cardiac issue and very likely not related to the heart itself. The x-ray was somewhat bothersome because part of the x-ray suggested that the aorta had dilated up and there were no changes on the electrocardiogram suggesting an acute heart attack or coronary event. Her physical examination was unremarkable and none of the findings that one would expect to find were there, but we were very bothered by the story and the changes on the chest x-ray. When questioned further, Penny did admit to the severity of the pain and the sudden onset of it, which made it very suggestive that this might be a dissection or tear in the aorta, which is an emergent life-threatening illness.
And I actually was honest for one of the first times in my medical history. And within a very short period of time, an MRI had been ordered, and I was taken to White Plains Hospital. When the MRI was over, they said, "We need you to go to the emergency room," where both Claudia and Gary were waiting for me. And Claudia said, "Okay, you need to take off your clothes, lie down, and an ambulance is coming." I think Gary was at that point talking to my boyfriend at the time, who's now my husband, and organizing for a doctor. I was given a telephone. It was suggested that I make some phone calls, send some emails. Claudia gently told me that I was going in for open heart surgery, and this was very serious. And within, I would say, maybe a half an hour. An ambulance came. I had called my children. I'd sent an email to my office saying I probably won't be at work for a couple of weeks. I don't think I had any idea quite how serious things were. And the next thing I knew, I was at Columbia Presbyterian, where through the intervention of Gary, Alan Stewart was waiting for me, who now my understanding is probably the best surgeon in, if not in the state, if not the country. But he saved my life, and apparently almost everybody dies from what I have. So it was the brilliant and very quick intervention of the doctors here that got me to Columbia Presbyterian that saved my life. And let us say, amen.